Mbulbunaka, ladies and gentlemen. The press conference today, I'm having it together with Major Naomi Wakandewambuka. He is the main military personnel that is looking after the quarantine facilities and is part of the multi-agency group that is looking, that is part of what we call our COVID response unit. So we have changed the COVID incident management team to be a COVID response unit now. The general manager of the COVID response unit is Dr. Anna, and she will be a regular part of our ongoing media team that will engage with you as we move forward. Today we are announcing two potential cases of COVID-19 at our border. We are not yet counting them as official border cases for Fiji yet, as we are awaiting information as to whether these individuals had been tested positive in another country in the past. These cases are a bit different to the usual. So I request that you please bear with me as I try to explain this situation. As we have outlined in the past, Fiji has allowed for importing and exporting via cargo ships throughout the COVID-19 pandemic to maintain economically vital flows of goods in and out of this country. Without this, we would run out of many of the basic goods of everyday life. So to support this essential service, the Ministry of Health and Medical Services have worked with the Fiji Ports Corporation Limited, FPCL, and Fiji Ports Terminal Limited, FPTL, to develop protocols that allow the cargo ships to enter Fiji ports without jeopardizing Fiji COVID-contained status. Some of these protocols include the following. If any crew are to disembark a vessel arriving from another country, we must first receive permission from the Department of Immigration, who then consult with the Ministry of Health and Medical Services. They will undergo 14 days of border quarantine, test negative for the COVID-19 in quarantine before they can come out into the community, in the same way that we are doing for the incoming air passengers. If no crew is planning to disembark from the ship is permitted to enter the port. However, no one on board leaves the vessel at any time. Therefore, they remain at our border until the ship conducts its business and departs. Only authorized Fijian personnel are permitted to board the vessel on official business. And they must wear appropriate personal protective equipment and maintain a safe physical distance as much as possible. So in line with these protocols, on the 2nd of December 2020, the freighter MV Island Chief arrived at Lautoka Port to deliver cargo. Then it proceeded on to Suva Port. The vessel's last port of call was Nuku'alofa, Tonga. It arrived in Nuku'alofa and departed Nuku'alofa on the 30th of November. The information we have at this moment is that none of the crew left the vessel in Tonga. The MV Island Chief had arrived in Nuku'alofa from New Zealand, where it had been stationed from the 16th to the 25th of November. During the time in New Zealand, the vessel underwent a crew change, where individuals are typically flown in from other countries to replace the existing crew. Our current information is that all crew underwent the full 14-day quarantine and they tested negative for the virus in New Zealand before the vessel departed. We are making contact with the New Zealand health authorities to verify this information, particularly the negative test results. As is standard procedure, when the vessels were arrived into our ports, the vessel was guided into Lautoka and Suva Port by the Fijian pilot officers equipped with the proper personal protective equipment. While in Fijian waters, the vessel was boarded by one shipping agent 2 biosecurity officers, 1 customs officer, and 3 ports terminal officers. As part of a document exchange, one of these individuals, a customs officer, made contact with the ship crew. He was equipped with the proper personal protective equipment and maintained a safe physical distance as much as possible. None of the crew of MV Island Chief disembarked the vessel in Fiji. The MV Island Chief was scheduled to depart for Samoa. Prior to departure, the crew members needed to be tested again for COVID-19 in accordance with Samoan entry requirements. To accommodate this request, a team from the Ministry of Health and Medical Services, wearing appropriate personal protective equipment, boarded the vessel and collected the samples for testing from all 12 crew members. As a result of this testing, 2 crew members of the MV Island Chief had tested positive for COVID-19. The first tested positive twice on the December 4th and December 6th. The second member has tested negative on December 4th, then positive on December 6th. Now, the positive results are both what may be called, in our language, we call it weak positive, indicating that a very small amount of viral material was present in that material, in the sample. The international evidence around COVID-19 molecular testing indicates these are not likely to be live virus. Based on these results and the fact that both crew have no symptoms, the indication is that they are at the end of an illness process and they are what we call historical cases. If true, then they are not infectious while at the Fiji border. And we are exploring options for further testing to confirm what we feel is the most likely scenario. The 2 crew members that have tested positive have been hygienically transferred to Navua Hospital and will be staying in our Navua Hospital isolation ward. The remaining crew members, they stay on the boat, but they will be in quarantine waters. And they will be overseen by our security personnel. We are also deep cleaning all relevant facilities, including the Harbour Master's office and the pilot boat. Again, to be clear, no crew member aboard the MV Island Chief disembarked the vessel. All Fijian officials who boarded the vessel were wearing the appropriate personal protective equipment. Test results indicate that these 2 cases may not have been infectious. However, acting out of an abundance of caution, all Fijian officials who boarded the vessel have been identified and entered into quarantine facilities. We identified 21 close contacts of the Fijian officials who interacted with the vessel and are in the process of also entering them into the quarantine facilities. Until we have established that there is no risk of transmission in the community, the Colonial War Memorial Hospital and Lotoko Hospital will operate at reduced capacity. Again, we are acting out of an abundance of caution in the interest of our people's health and well-being. Fiji has always applied a rigorous approach to our containment of the virus. We will be sure to update you if we have more information about these cases. Now, there have been questions as to why we have maintained some of our COVID-safe restrictions if Fiji is COVID-contained and all the cases are at the border. These potential cases demonstrate why. We are relying on our dedicated men and women at the front line, protecting our borders and caring for the border cases in our isolation units under strict infection prevention control protocols. But we have seen breaches happen in countries that are more advanced than Fiji. We have watched this happen, and every time it happens, we improve our processes as a result. but it still can happen in Fiji. In that worst case scenario, our society must be, and for this is the word of the season, we need to be COVID ready. That's the word for Christmas, COVID ready. As we did in March and April, every Fijian must take ownership of our national effort to contain the virus. Until such a time when the vaccine is widely available, we cannot become complacent. At this point, I just want to reiterate again, we need to be COVID ready. And what does COVID ready mean? The community needs to take responsibility for all the COVID safe measures that we've been asking them to do, so that if the virus should break our borders, it will take 1, 2 persons, and the virus will die on its track before we know anything. That's the meaning of COVID ready. I urge all Fijians again, if you have not downloaded and installed the Care Fiji contact tracing application, please do so. In this instance, we have once again relied on contact tracing as our most effective tool to reduce any risk of spread among the community. The Care Fiji application, when widely adopted, makes this process more efficient and more reliable. Downloading the application isn't difficult, and it makes the potentially life-saving work of our contact tracers much easier. As part of our COVID-safe economic recovery framework, we have allowed some nightclubs to reopen, but not as nightclubs. They reopen as venues where groups of people who are in one bubble, they can have a drink in a COVID-safe manner with a social bubble of friends. Now, we did this to manage risks while allowing for people to return to their jobs and to generate some economic activity. However, there are numerous reports that some people may be breaching these COVID-safe restrictions. Let me be very clear that if any of these venues are found to be in breach, we will shut it down. And when I say we will shut it down first and ask questions later. With our 66 billion cases confirmed worldwide and over 1.5 million deaths, the COVID-19 pandemic is only worsening around the world. And Fiji, the small country around the world, remains COVID contained. Together we can keep it that way. So please adhere to our COVID safe measures so together we can be COVID ready. Thank you.